Of course I was scared, but I figured if I survived the impact, that was already a miracle.
And I was just in shock. I was pretty much helpless. My life was in everybody else's hands.
He told me, we'll keep going until we do find somebody, because I couldn't find no other doctor that would take a chance on me.
That really showed me they cared. They have built an amazing foundation for every family to succeed. My pregnancy was very, very smooth. All of the ultrasounds, the follow-ups, everything expecting to be a very healthy baby.
From the moment we got into the hospital, we were both very excited. I had just rushed from work to get in there. She was already there, set up. They had started inducing her. She was happy, taking selfies and, just being really cheerful. And yeah, it was an exciting mood.
As they started inducing me, I wasn't dilating. I got a fever all of a sudden.
They actually had to talk to us about possibly getting a C-section.
The C-section discussion happened, and then they said, actually, we have to go right now.
When we go to these C-sections, it's usually because the baby inside the mom is having difficulty and the OBs were worried about it.
They got her out and, I thought it a little bit strange. She seemed a little pale to me, but I've never seen babies before, so I don't know.
It's just that once they cut the cord away from Mama, Kyla became very sick. It was really obvious she was very dependent on her Mama.
He brought Kyla to me and said, oh, he wouldn't let me hold her or anything like that, but it sounded like, look, you kiss her and we have to go, kind of sense of urgency.
Kyla was not taking care of her airway and she needed an airway, so I unfortunately had to put a tube down her in order to breathe for her. Sometimes when babies are very sick, the body itself starts to want to revert back to how it was when it was inside the mom. We call it fetal circulation, and she started reverting back that way. The blood pressure in her lungs went very high. It was hard for her heart to pump blood into her lungs, and put her on a special ventilator called an oscillator. She was on just maximal support.
The final one that was really hard was ultimately they came back and said, okay, the ventilators, they're not going to work. We're maxing out the settings on that. We'll need to try something else, something called ECMO.
There was really no choice, it was, these are all the risks, but if not, she's not going to make it. This is the last chance for her survival.
Robert actually called us and he said that despite all the things they were doing for her, her lungs were continuing to worsen, and so they needed to meet with them to talk about the possibility of having to put her on pulmonary bypass. It's called ECMO, stands for extracorporeal membrane oxygenation, and I think the next thing I felt was relief because these people know what they're doing. I work with them on a day-to-day basis, and I trust them with her.
Kyla had meconium aspiration and had a little bit of a difficult delivery, and she was put on ECMO, and she did amazingly well.
The day that she was coming off of ECMO, I was so excited.
One of the exciting moments, in the whole process of weaning her off from the ECMO was witnessing her first actual breath.
As an expecting parent, you're excited to take all these, videos and pictures. I didn't expect to be taking a video of her first breath.
2 and 3.
But when she got off, she did great. It was like clockwork after that. We thought she was going to go home on oxygen, and Kyla proved us wrong again. She went home on room air. Her getting home so soon wasn't just because of us. It was because of many people that were involved. The respiratory therapists were very important, helping us to get her off of the ventilators. And this would have never happened without lactation consultants.
So human milk we know is the best thing for our babies. But in the NICU, human milk is even more important. It's almost like a medicine for them.
Overall, it's a real comprehensive teamwork of not just medical, but your emotional, spiritual, and they have built an amazing foundation for every family to succeed.
That's why this hospital is here. That's why these programs are here. They're being done not because it makes sense financially, but because it's part of what this hospital does.
Parents never lose hope, and we as physicians should never lose hope. And I think the whole type of technologies and type of resources that we have available to us at Capilani so we can save lives like this provide that hope.
My wife and I, Amanda, decided to take our honeymoon here on Kauai in 1988, the year we were married. In 1991, our son Nick was born here at Wilcox Hospital. We have 2 other children, and we just love Kauai. We're probably not going to ever leave. So January 13th, 2018, I was driving north on one of the main highways here, heading north in the dark, and all of a sudden some headlights appeared in my lane with about 1.5 seconds to respond, and we hit head-on. I blacked out, but when I came to, there was all kinds of EMT, emergency vehicles, people talking to me, trying to help me. I was in a lot of pain. I knew that I was hurt. I didn't know how badly until I looked down at my right leg and it was pointing in the wrong direction.
Mr. Worley, in addition to the bad femur fracture, the pulseless leg that we had to reestablish the pulse in, he also broke his left 2nd, 3rd, 4th, 5th, 6th, and 7th ribs on the other side. So you got a stack of ribs broken here, a stack of ribs broken here, a broken sternum. That's a lot of broken pieces moving every time you breathe. And so for him to be able to cooperate, tell me where he's having pain, tell me about his medical history, while every word he was speaking was probably excruciatingly painful.
I'm constantly texting family and letting them know, that he was in a really serious car accident. But just seeing him, how I knew how broken he was.
Of course I was scared, and I didn't know what was going to happen. I didn't know if I was going to make it or not, but I figured if I survived the impact, then that was already a miracle.
Because of the accident, there was significant pileup and backup in traffic. Our trauma surgeons were backed up in traffic. And on top of everything that was going on, we got the alert that there was a ballistic missile incoming.
It's a lot of chaos that's potentially going through your mind, but I think the bottom line is we know we have a duty that we need to fulfill, and you try to put those other nerve-wracking, stressful ideas out of your mind to just focus and complete the job that you need to do.
But they never stopped giving me the attention that I guess I needed to have at that moment.
So after we knew all his injuries, I think the most important thing is the patient stable enough to go to surgery? And it's a fine balance because the lung contusions can blossom and then they can go into respiratory failure. But at the same time, the femur needs to be fixed so they don't continue to lose blood from that broken bone.
We took him to the operating room. We were able to anatomically align his femur with the titanium rod, and there were no complications with the surgery. So at that point, we informed Michael that he had a very long and difficult rehab ahead of him.
I've got to say that my recovery was quicker than most people expected. However, it was a long process. I think I was in a wheelchair for about a month. Then I went to a walker, and I used that walker for quite a while to get around. My goal was always to be able to get back in the water. And for me to be able to get back in the water and surf or stand up paddle is the thing that's motivated me the whole time to keep working on the rehab.
Just watching him finally get to go back to surf was a huge thing, because I didn't think he'd be able to do that.
As doctors, we put our heart and soul into this. When things go well, when we have patients like Michael who survive horrific injuries and not only survive them, but recover in a stellar fashion. These are the moments where we feel immense reward and gratitude that we have the tools and the staff that we need to provide excellent care and to make sure that patients have the very best chance of getting back to a normal life.
I would just encourage people to never give up. Remember the things that you love to do and work towards reaching those goals, because no matter where you find yourself in life, if it's down in a valley, if it's after an accident, there's always hope.
About 5 years ago, I remember a guy walking in asking for an application and asked me for my number. Every day since then, showed up with roses, Starbucks, and a plate lunch every day. And now we're 5 years later and we're together still and getting engaged and hopefully getting married soon. Don't have a date yet, but hopefully soon.
About 3 years ago, I watched her and she could hardly walk, most of the time sleeping, all day sleeping. I was watching it get worse and I felt hopeless. And then we finally met a doctor who would change our lives.
Immediately when she walked into my office, I knew she was sick. She was yellow. Her skin had a lot of scratch marks on it. I could hear her breathing down the hall, and her liver function tests were off the charts. So it was just a matter of time that she would go into liver failure.
The other facility felt that she was too high risk and basically said, just live out the remaining days of your life, and this is the best that we can do. Well, we felt differently. We felt that we could give her a chance, knowing that the risk is still high, only if she's willing to collaborate with us, work with us, and believe in us. And I think that's the key mark here.
If it wasn't for Dr. Lei being so convincing, he works really hard, and you can tell the care that he has for his patients and that confidence that he has is what made me want to stay and believe that maybe there is a chance, because I couldn't find no other doctor that would take a chance on me. And he had such high confidence. He told me, don't worry, if we find another doctor, we'll keep going until we do find somebody.
My motto since high school has been, we must either find a way or make one. And that is exactly what we had to do in this case. The decision we faced was that this condition that she had would have been fatal if it wasn't treated. And so we were faced with the reality of, well, she needs it. We have the expertise, we have the people who can do it. Just because it hasn't happened here like this before doesn't mean we can't bring that together and make that happen here.
A few days before surgery, Charlene had doubts of whether she wanted to go through with this. She was just exhausted. She was just tired of waiting for the right moment, and she just wanted to leave, just pack up and leave. And we brought her fiance in and trying to help her understand that if she leaves the hospital, she's going to die. There was no question about it.
I didn't want her to give up on me because I wouldn't give up on her. So I told her to fight for me like I would fight for you.
Respiratory therapy, pharmacy, the intensive care physicians, myself and Dr. Ver, as well as our colleagues from nursing who had experience with these medications, all of these people had to come together and work in symphony to safely see her through.
My colleagues share with me that she probably would only have 5 or less than 10% of making through the surgery. Despite those low numbers, we felt as a team that we could come through for her.
She woke up, she thought that she didn't do the surgery yet. And I told her that it was done already, all the surgeries are done. And she's gotta recover and get better and get out of here.
What impressed me about this particular case was people really gave it their all. They threw their whole selves into really going the extra mile, digging deep, and you really appreciated the extra effort that they put in to make absolutely sure that they had everything that they needed.
Now 3 months out, I'm feeling 100 times better than I was. Nothing can get me down anymore because I was given another chance. And if it wasn't for Polly Momi and their team, Dr. Lay, Dr. Vera, everybody, I wouldn't be here anymore. I would have lost that chance. So I'm forever grateful, and I just look at life like that every day.
Being able to lace up my shoes and go for a run in nature is a blessing. After what happened to me, I will never take for granted the body and health that I have. I was installing a key lockbox for my fiancée Lucy in her condo in Waikiki. I decided to fasten it on this metal beam. Unfortunately, I didn't realize that that was the power supply for the elevator, which carried about 480 volts and created a 1500-degree arc flash, which caused a third-degree burn on 40% of my torso. Fortunately, I had safety glasses, which didn't cause me to go blind, but everything else was pretty much instantaneously burned.
I was looking up the building, and then that was my room, that smoke coming out. The manager was walking to me, and she said, "Lucy, look at me, and then I gotta tell you something. Something happened to Lance."
At that moment, Lucy, my fiancée, she's tried to call me on my cell phone. Unfortunately, I didn't have any fingertips so I could swipe my phone. Paramedics came with the gurney and then proceeded to go downstairs. As I was exiting the lobby, I could see Lucy in the foreground.
His body was red. And his face was different. And I couldn't breathe. And then that's the last thing I remember.
In my evaluation of him, he had pretty significant burns to basically the face, his chest, and both arms that involved about 40% of his surface area of his body. Lance's predicted mortality based on his injuries, meaning the chances that he wouldn't survive this, was somewhere between 20 to 30%. And so that's a conversation that I had with his family.
So it was hard to see him like that. Just the only thing going through my mind is to support him and be there for them.
Now, once I woke up in the ICU, I was all bandaged up. I was swollen. You know, it was just a lot of fluids being pumped into me.
Lance underwent a number of surgeries to ensure that he maintained functionality of his hands, his face, being able to open and close his mouth effectively, and get him back to as much of the baseline life as he had previous.
Undergoing burn care is probably one of the most difficult things patients need to undergo. It can be pretty painful, and it's a daily process where the patients are taken to the treatment room and basically you're washing their burn wounds.
One of the things I needed to do is just listen to the doctors, follow their instructions, listen to my therapist, follow their instructions, because the faster I can heal, the faster I'll get out.
So he would get therapy daily from occupational therapy. And then as he progressed and was able to tolerate more, we would occasionally see him twice a day.
So it is a multidisciplinary team that's ensuring that this patient has the utmost cutting line care that they can have to reintegrate into society.
One of the biggest, I would say, positive reinforcements was having other burn survivors tell their story. Just the fact that you can come out of a burn situation in a positive light was very inspiring.
You know, I'm so proud of our patients when they realize that they have the strength to get through, because there's some days where it's really hard. So seeing them get that strength, and it comes from them, but our nurses, you know, foster that, our doctors foster that, the whole team, to encourage them, like, yeah, you can do this, you will survive. Others have been there before, and we know what we're doing.
Now that I'm on my 2.5-year recovery of being a burn survivor, one of my goals is to give back to the other burn survivors. I want to be able to comfort them, because no matter what, it's going to be a long road. And if I can help anybody, I'll be happy.